SoundBytes from Vet Advantage, an official publication of the NAVC. We're taking a closer look at Cabrovet Ca1 potassium bromide chewable tablets from PRN KBroVet. You can find all the information in this video inside a recent issue of Vet Advantage magazine. Just look for the PRN KBroVet Ca1 tear-out. When it comes to the most common chronic neurologic disorder in dogs, take a closer look at the reasons why the first and only conditionally approved anti-epileptic for dogs can play a role in idiopathic epilepsy control with veterinary clinics and their patients. Let's briefly touch on what conditional approval means so that you can discuss this with veterinarians. Conditional approval means that the product has been demonstrated safe and that there is a reasonable expectation of effectiveness, which means that the product is reasonably expected to provide the intended effect when used under the conditions described in the labeling. To learn more about conditional approval, visit the link on the screen. Cabrovet Ca1 has many benefits. Cabrovet Ca1 is the first and only conditionally approved drug by the FDA for seizure control in dogs. Safety, quality controls, dosing, and a reliable expectation of efficacy have all been demonstrated to provide assurances to veterinarians that the medication they're prescribing is reliable. Cabrovet Ca1 is a liver-flavored, chewable tablet administered once a day that is formulated specifically for dogs. This offers a convenient option for owners that cannot dose their dog multiple times a day. Cabrovet Ca1 has a half-life of at least 21 days, the longest half-life of all seizure anti-epileptic options. Due to this, fluctuation in drug concentration is unlikely to occur. This minimizes the occurrence of a seizure even if owners miss a dose. Cabrovet Ca1 is excreted through glomerular filtration. This is an ideal choice for dogs with compromised liver function that cannot tolerate anticonvulsants that affect the liver. Cabrovet Ca1 is available in 60-count bottles, with 180-count bottles coming in the summer of 2021. Having a variety of bottle count sizes provides more flexibility when dispensing. In study results, Cabrovet Ca1 showed overall 67% treatment success. Based on the study protocol specified criteria, 27 of the initial 51 cases were determined to be valid for effectiveness data. As the sole anti-epileptic, potassium bromide achieved 67% overall treatment success in all three categories. For seizure counts, 19 out of 27, or 70%, were defined as treatment successes. Seizure events per month, 67%, or 18 out of 27, were defined as successes by either decreasing the number of seizure event days per month or showing no change. Seizure severity scores, 93%, or 25 out of 27, were defined as successes by either decreasing seizure severity or showing no change. In a retrospective field study of 51 dogs diagnosed with idiopathic epilepsy, clinical findings of dogs treated with KBR were documented for the initial 60 days of treatment. The most common clinical abnormalities documented in the 60-day period following the initiation of KBR therapy included increased appetite, weight gain, vomiting or regurgitation, sedation, and neurologic signs. Practitioners should tailor therapeutic regimens and clinical monitoring to each dog. Availability of an appropriately FDA-labeled, approved KBR product could provide better assurance to veterinarians and their clients of the quality, safety, and effectiveness of a product for veterinary use. Important safety information. Cabrovet Ca1 is conditionally approved by the FDA pending a full demonstration of effectiveness under application number 141-544. See prescribing information for complete details regarding adverse events, warnings, and precautions. It is a violation of federal law to use this product other than as described in the labeling. Contraindicated in dogs with a history of hypersensitivity to bromide. Not for use in cats. Not for human use. Keep out of reach of children. Contact a physician in case of accidental ingestion by humans. The most commonly reported side effects were increased appetite and thirst, increased urination, weight gain, sedation, and ataxia. Reversible neurologic signs, sedation, ataxia, weakness, were generally associated with adjunctive potassium bromide treatment or high serum bromide concentration. Animals with kidney disease may be predisposed to bromide toxicities. The safe use of Cabrovet Ca1 has not been evaluated in dogs that are intended for breeding, are pregnant or lactating, or less than 6 months of age. Use caution when changing diets. Administering chloride-containing fluids and administering concurrent medications. Careful monitoring is important in dogs that have a condition that may cause difficulty maintaining electrolyte balance. When visiting a practice, ask, "Doctor, can you talk to me about your seizure management protocols once you diagnose a canine patient with idiopathic epilepsy?" Listen, then explain. PRN Pharmacol's Cabrovet Ca1 potassium bromide chewable tablets is conditionally approved by the FDA to control seizures in dogs. Additionally, Cabrovet Ca1 does not induce or increase hepatic enzymes, making it a great choice for dogs with compromised liver function that cannot tolerate anti-epileptics that affect the liver. If you have any patients that would currently benefit from this product, let's take a closer look at some other features and benefits of Cabrovet Ca1, including that it is administered only once a day. You can confidently position the product by saying, PRN Pharmacol's Cabrovet Ca1 is the only FDA conditionally approved drug for seizure control in dogs. This product provides better assurance of quality, safety, and effectiveness. After an open discussion, leave it up to the customer by saying, when you take a closer look at Cabrovet Ca1, it's easy to see why potassium bromide can play a versatile and important role in your seizure management protocols. Thank you for taking time to discover the benefits of PRN Pharmacol's Cabrovet Ca1.